But thank you so much for joining us again this evening for another enlightening talk by Dr. Doug Ebersole. And we're so grateful, Doug, that you're willing to do these presentations for us. And I know our clients are very grateful and enjoy them tremendously. Got a lot of positive feedback on your presentation on diving in the era of COVID. So very much looking forward to this one. I personally got stung by a lionfish many years ago in Thailand, in the days when I thought it was fatal. And so I was pretty convinced that I was going to die on that trip. But one of the boat boys, one of the dive helpers, came out. I signaled from the surface that I was in trouble, and he came out and immediately sucked the venom out of my finger. And I didn't die.
That's good.
But it was the most painful thing I've ever felt in my life.
Yeah, I've never been stung, but I've seen one person that got stung and his hand got to twice the size of normal, and he would look like he actually ended up in the hospital with IV narcotics. So it looks very painful.
Yeah, I was out in the middle of nowhere on a liveaboard in Thailand, and this was probably in the late 80s. So it was there was still not a lot known about it. And when I read about it, when I got back, it said that, you know, that they typically aren't fatal, but that the pain—
You wish they were.
The pain can be so bad that people writhe around in pain on the floor. And that's what it felt like. And it hurt like that for months afterwards. I mean, not as bad, but I could still feel the pain for months afterwards. It was painful.
Beautiful fish, but stay away from them, right?
Yeah. It was kind of a funny story. There was a guy on the trip that was having a lot of trouble. He wasn't one of my clients. And the captain of the boat asked me if I would take him under my wing as an instructor and kind of help trying to get him comfortable. And, you know, normally as an instructor yourself, you know, that's never a good idea. But I felt bad for the guy. He's on a 10-day liveaboard and
with nobody.
They're not going to let him dive, right? So I took him under my wing and I wanted to show him some cool things. And I found a lionfish underneath a little ledge, and he was kind of right on my shoulder, and I wanted to coax the lionfish out so that he could see it. So I picked up a little piece of dead coral and kind of coaxed it out from behind so that he could see it. And when I looked back to make sure he was still with me, the lionfish jabbed me in my fingers. And so it's like, great, I'm trying to show this guy what a good time diving is, and I die. But no, it was worth it. He ended up becoming a really good customer of ours in the long run.
Good.
But
he probably didn't buy a zookeeper.
No.
Or a pole spear. He's like, I'm not touching those things.
Well, and again, that was in the days when we didn't hate lionfish.
Right. And it's also in Thailand, so that's okay. It wasn't like it was in the Caribbean.
It's funny that that impression of lionfish has changed so much in the last several years. They used to be considered beautiful. Everybody loved looking at them, and now they're kind of the evil parasite in the Caribbean. So
right.
But
you see more of them in the Bahamas or the Caribbean than you see in Indonesia.
I know, it's sad. And no matter what they do, they're still reproducing and in mass. So it's unfortunate, but it'll adapt eventually.
Oh yeah.
So what do you think? I think we should maybe get started. It's about 5:35 right now. It looks like we're still getting a few people signing in, but for those that are here, I think we should go ahead and get started. So again, I want to thank everyone for joining us this evening, and welcome Dr. Doug back to our shores, so to speak, for another presentation this evening on hazardous marine life. I'm personally very interested in this because I've had a few encounters myself. So I think most of you know Doug from that were part of our presentation a few weeks ago on diving in the era of COVID. But Doug is very active in the dive community. He has multiple certifications. He's a registered cardiologist and also a consultant with Dan, the Divers Alert Network, a COVID survivor, which we learned about the last time he did a talk with us. And very, very well respected in the industry, and a lot of knowledge that he's kindly willing to share with a lot of us. So without further ado, I'm going to turn it over to Doug. How about it?
Okay, I'll share my screen here. So let me know if this works here. Should be up now. Do you guys see my screen there?
Perfect.
Yep. Okay. All right. Well, thanks, Steve, and thanks, Kelly. For those of you who were not here a month ago, Kelly and Steve were kind enough to ask me to speak on diving in the era of COVID-19, which I've done a few times because of my own personal journey with that. And I was asked if I could present again. I said, absolutely, I'd love to do that. And I gave Kelly a series of options for topics, and she suggested I talk about hazardous marine life. So that's what we're going to talk a little bit about today. This talk originally was put together for a diving medicine conference I was going to. So some of this stuff is going to have a lot of specifics that a lot of you who aren't medical probably aren't going to care about, but just glance over that and don't worry about it. Realizing at the very end, I'm going to have a very few little bullet points that everybody can remember just to kind of get us all on the same sheet of music, how you can kind of remember general principles as opposed to worrying about what particular animal you need to do what particular treatment for. There's some broad categories that make it much easier. For those of you who don't know me, I put the slide up because this is kind of like, who is this guy and why is he talking to us? Like Steve was kind enough to say, I'm an interventional cardiologist in Lakeland. That means for a living, I basically wear pajamas to work and stand in an operating room or a cath lab and look at screens of x-ray or ultrasound and close holes in the heart or open up valves or repair valves or put stents in, all that kind of stuff. So I basically play video games for a living. And then on my free time, I've been scuba diving since 1974. I do all kinds of diving. I enjoy recreational diving. I enjoy technical diving. I really enjoy rebreather diving and cave diving. So from a recreational standpoint, like I was mentioning to Steve a little bit earlier, I teach recreationally for SSI, for NAUI, for SDI, and for RAID. From a technical standpoint, I teach all the way through CCR Trimix. I'm an instructor trainer for CCR Trimix for both INTD and TDI. I sit on the INTD Board of Advisors and the TDI SDI Training Advisory Panel, and the training agency RAID has made me their medical director. Like Steve mentioned, my background of being not just a cardiologist and a diver, but being a very active diver. I usually dive between 100 and 150 dives per year, and all different types of diving. So that combination generates lots of emails and PMs on social media and so forth about questions. So I started working with the Divers Alert Network about 10 years ago as a volunteer consultant, and answer a lot of their cardiology questions about what to do if someone has had X cardiology problem, diving with stents, diving with bypass surgery, so forth, atrial fibrillation, blood thinners, and so forth. So I've been doing that. And then in my free time, I'm also the Florida sales agent for KISS Rebreathers. So why are we talking about this? For marine life injuries, well, 71% of the Earth's surface is covered by ocean. 80% of the world's population, not you guys in Denver, but 80% of the world's population resides in coastal regions. And back in 2010, there were about 127 million U.S. citizens living along the coast, and those numbers continue to grow. And people who don't live on the coast tend to visit the coast. So we have lots of people who are interacting with marine life. The good news,
if you don't mind me jumping in for just a
sure.
second. I neglected to remind people that they can chat with us throughout this presentation if you'd like. If you're unfamiliar with Zoom, if you go down to the bottom of your screen, there's a little chat icon. If you hold your mouse over it, you can click on that and send messages, and Kelly will be more than happy to respond if she can, or keep those questions till the end and share them with Doug. So feel free to jump in and do that anytime you want. Sorry to interrupt, Doug, but I want to make sure people knew that. So
no problem. Happy to do it. Okay, so the good news is that despite the worries of generations of novice divers, there's absolutely no marine life that survives on a diet of humans. Okay, so that's not really much of an issue. Most marine life injuries, the vast majority of marine life injuries, are generally the result of poor buoyancy skills and bad diving habits. So really this talk could be broken down really into the following. The easiest way to avoid marine life injuries is to practice good buoyancy. Don't touch things, and don't harass marine life, and wear good protection. Buoyancy is, as any of you know that have been diving for a while, is probably the number one problem that novice divers have that they eventually get better at over time. And historically, you know, when we all got training years ago, you basically overweight your divers, sit them on the bottom of the pool or the bottom of the ocean, have them go through their skills, and then you wonder why when you let them go, they're bouncing along the bottom because they've all been overweighted their entire diving career. So thankfully, there's been a move towards doing skills being taught neutrally buoyant, and that should help. And if there's people out there having a problem with buoyancy, call Steve, call the shop, and take a buoyancy class. That's probably one of the best things you could possibly do to help you avoid marine life injuries. Again, don't touch things. I didn't say wear gloves. I said don't touch things. In fact, lots of places they don't allow you to wear gloves because they don't want you touching things. Don't harass the marine life because most injuries are defensive. They're not animals going out trying to hurt you. And exposure protection is very, very helpful. And I recommend people wear full suits, not shorties. I know some people like to go to the Caribbean and say it's nice and warm, so they want to be in just board shorts and a rash guard. While that's comfortable from a water temperature standpoint, it's not real safe from an exposure protection because it's very easy, especially for legs and so forth, to bump into things and end up with a marine life injury. So it also helps with your buoyancy and your trim to have a full wetsuit on as well. Okay. The way we're going to break this talk down a little bit is we're going to talk about things that bite, rip, puncture, shock, and so forth. We'll look at things that sting, things that are poisonous, and things that induce allergies, and go through each of these. So I'm going to go through individual animals and kind of what the treatment is and so forth. But again, like I mentioned before, don't get hung up on the details. I'm just going to show you what information's out there. And at the end of the talk, we'll kind of tie it all together into some bullet points that make it a little bit easier to remember. This to me is probably the most dangerous aquatic animal to get into. This is a dive master, a very good diver, Grant Kamen. This was many years ago. We were on a technical dive, and you see the rebreather divers in the background. And she was actually one just kind of grabbing the tanks once we're finished with deco. So she just jumped in a bathing suit. But I took this picture and thought, this looks like someone diving naked, but that's not what she was doing. Okay, animal bites. The first one we'll talk about is things that bite you. If you get bitten by any kind of animal, whether it be topside or underwater, the basic wound management is just irrigation. So you want to take saline if you have it, tap water is fine if you don't, and flush wounds out very, very well. If you have some sort of a little catheter you can make kind of a jet out of, like a little angiocatheter or a needle, so as you're pressing the water, you get a nice jet. That'll work better because that helps clean out the wound. You want to use at least 100 or 250 cc's. That's about 8 ounces or so. And then you could apply your typical kind of iodine, chlorhexidine, topical antibiotics, and so forth to try to help with any kind of infection. If you have a really nasty wound, that's going to be something that's going to need to be taken care of professionally at an ER and so forth, and they're going to need to debride that. Everybody wants the wound closed, but you'll find out sometimes we leave wounds open, and the reason we do that is because you close it, obviously, to have a little bit better cosmetic result without a nasty scar. But when you have something that could be trapping bacteria and so forth in the wound and you close it, that can cause a lot more harm than good. So there's all that question. And then we have to always remember that if you had a bite, to get tetanus prophylaxis for Clostridium and so forth. And everyone should get tetanus shots about every 10 years. These are kind of gross pictures. This will be the only gross pictures. The reason I bring it up, ocean water is mainly salt, and there's different organisms that live in the ocean. Most of the marine bacteria that we get infected, so if you get like a cellulitis from a marine puncture or scrape or cut that then gets super infected with bacteria, they tend to be what are called gram-negative rods or vibrio, which are very difficult to treat. And that's entirely different than the normal skin flora that we get if you were to have cellulitis on the surface of topside. So the reason I bring that up is if you have a cellulitis, your leg's turning red or whatever, and you go to a doctor, it's important to let them know that you've been in the ocean, because if you've not been in the ocean, you have a cellulitis, we're going to typically treat for staphylococcus or streptococcus with one set of antibiotics, which is going to be totally ineffective if what you really have is a cellulitis from the ocean. So if you ever develop any kind of skin erythema, redness, tenderness, and so forth. It looks like a cellulitis, and you go to your doctor. If you've been in the ocean recently, please make sure you tell them that, because it changes the antibiotics we would use drastically. This is an example. This is somebody who had a little nodule there on their knuckle, and also on the finger. You see the finger, they kind of closed it with sutures, but over time it kept getting worse and worse and worse. And it's a case where somebody had they had a Vibrio from the ocean, and they're being treated for a presumed just cellulitis with typical first-generation cephalosporin, and that did not work out so well. Luckily, they had to remove this big little area, but it healed up. But that's the important point, is simply that you need to make sure you let your doctor know where you've been, because it changes how we're going to treat things. This is just for anybody who's medical in the audience. Most of these organisms that we have in the ocean require third-generation cephalosporins. The typical easy ones like Anceph or the other first-generation cephalosporins are not going to work. And you may have to pull out the big guns, the ones on there in the last bullet point, which are very expensive antibiotics. So basic principles for just little minor abrasions or lacerations. You bump into something, you get a little cut. The vast majority of people do not need antibiotics for that unless they're immunocompromised. If someone were on steroids because of some sort of immunosuppression for rheumatoid arthritis or lupus or something, that could be a much bigger problem. So if you're on steroids, so you're immunocompromised, or if you're, say, a cancer survivor and you're on chemotherapy, something that would put your immune system in jeopardy, you need to make sure your doctor knows that, because a cut could become a serious problem, and you would want to be on antibiotics for that. And again, if this does happen, even if it's in the ocean, we probably would still give you antibiotics to cover staph and strep, because those are the most common things. So you'd be treated both for the gram negatives for the ocean, but also the gram positives that we would normally get here topside. Serious injuries obviously required treatment and antibiotics and so forth and so on. Okay, everybody worries about sharks. Okay, most new divers, that's what they're concerned about. This happens incredibly rarely. Sharks have kind of two patterns when they're out feeding. There's kind of the normal feeding pattern, which is kind of the way this tiger shark from Tiger Beach is looking here. When they get into kind of a frenzied pattern, you'll see them obviously a lot more erratic activity. The pectoral fins drop, and it's a lot more concerning. Shark dives, I don't mind shark dives. I prefer the shark dives where sharks are baited in but not fed. Personal opinion. I think it's a little more normal activity you'll see them in. And I'm not real fond of the real frenzied things, where sharks are kind of going everywhere. It's unlikely anyone's going to get bitten, but you'll notice that in those cases, usually the feeders are wearing chainmail because they can't have inadvertent bites. If there is a shark bite, the vast majority of people, these are bites. They're not really attacks. They're kind of a bite, and they realize that's not what they thought they were getting. So it's kind of a mistake. So most people are only bitten once. Legs and buttocks are the most common, and most attacks occur either at the surface or within about 100 feet of shore. So it's more common in bathers, swimmers at the beach, or at the surface with people such as surfers and so forth. Because if you can imagine, if you're underwater and you're a tiger shark and you look up at the outline of a surfer laying on his surfboard paddling with his hands and feet, you look just like the outline of a turtle, and you'll get these ambush predators kind of hitting what they think is a turtle, only to find out it's not. But if it's a big enough shark with a big enough bite, you've got a real problem. And about 15 to 25% of these attacks are fatal, but the numbers are quite small. And everyone's seen these kind of numbers here before, but this is kind of an awareness slide of what the real risks are. You see sharks there in red at the bottom of the left column, but there's about 6 shark-related deaths per year, which is way below the danger of toasters on the upper right, with 700 deaths a year from toasters. And things like mosquitoes kill 1 million people a year, mainly from malaria. Snakes, dogs, hippopotamus, crocodiles, so forth and so on. So you see, we all get worried about that. Jaws, the movie Jaws, had a lot to do with that. But the actual likelihood of having a shark attack is incredibly small. Even 100 people die from icicles every year. I assume that's falling off houses and slicing someone's neck or something. Okay.
Can I interrupt really quick? We had 2 questions.
Sure.
Swollen finger.
Okay. Sorry about the photo there.
One, how long does it take for the finger to get that swollen? Was that like a 24-hour thing, or is that like a week long?
Oh, that was like a week thing. Okay. Yeah, several days to a week.
Perfect. And then what was the thing that looked like it was removed from the finger?
That was just a lot of scar tissue and just scar tissue, what we call, kind of thing. Just, I won't get into the basics, but yeah, just they didn't remove all that. It was just kind of an inflammatory response.
Got it. Thank you.
Okay. All right, so obviously now this is not me. I took this photo. This is my buddy petting the great white that's biting the cage. I would not recommend people do that. That's an awfully large mouth next to a very small hand. But anyway, the most immediate threat obviously is hemorrhagic shock from bleeding. You can still, with the shark bite, even if you survive, you still have to worry about the Vibrio species and the Clostridium species for a superimposed bacterial infection. And may require antibiotics. The other thing that people need to realize with sharks, because a lot of people like to touch sharks, they'll go to like the little nurse shark dives and hold the nurse sharks and so forth. Shark skin is designed to be very hydrodynamic. As long as you're rubbing your hand from the head down towards the tail, it's very, very smooth. If you move your hand from the tail up towards the head, however, it is very, very rough and can give you an abrasion and a cut that you need to manage like a second-degree burn. So don't handle sharks at all, but if you're going to, definitely make sure your hand's moving from head to toe, so to speak, as opposed to the other way around. Barracuda, this is another thing mainly novice divers are scared about because they drop in the water and they kind of look very menacing, kind of looking at you, but the likelihood of getting attacked by a barracuda is incredibly small. They're very rapid, fierce kind of attackers, and treatment is the same for any other kind of a bite with a shark. Morays have terrible eyesight, so they work on smell. So they can make mistakes and can bite people, but it's very uncommon unless you're provoking them. They'll usually try to get away from you and try to get out of the way unless you provoke them. They're very, very vicious biters. They have several rows of teeth, and they tend to clamp down. They tend to bite and hold on, and you'll get lots of small little puncture wounds. And the treatment, again, is just like shark bites, where you're going to want to irrigate the wound. They've got very nasty bacteria in their mouth, so the likelihood of getting infection is very, very high. So those people would need to get antibiotics, prophylaxis, to avoid a superimposed bacterial infection. Goliath grouper, we have lots of these in Florida. In fact, it's about to be Goliath grouper mating season. We have congregations in the tens and even in the hundreds on certain wrecks in South Florida this time of year, usually late August, actually about a month from now. These are very voracious eaters. They don't tend to bother divers unless you corner them. The most common time that would happen is you swim into a wreck and you don't realize they're there. They tend to let you know they're there. They'll bark at you, and it's a very low frequency bark that will actually, you can feel it go through your chest. If they do that, that's telling you that it's their wreck and you should leave, okay? If they do bite you, the bag's gonna be very ragged and macerated. Again, treatments for bites are all the same. Flush with water and treat with antibiotics if needed. So that's bites. Okay, so bites are treated with just irrigation, local irrigation, suturing if they're big or need to be, and antibiotics. Envenomation, lots of things can cause envenomation. There's a difference between venom and poison. Okay, poison is stuff that's actually in the skin, muscles, and of the blood and so forth that you could eat, and they're stable in gastric acid, and you get some bad effects from that. Venom, on the other hand, is produced in a well-defined organ, typical like Steve was talking about with his lionfish. There's usually injected in a defensive posture. These are heat labile. That means they break down with heat. So all of these envenomations you want to treat with the hottest water you can stand. Okay, and that's the best treatment for venom. And they can, obviously the amount of venom can be released in a variety of amounts. Here's your typical lionfish here. So these are vasoactive proteins. You don't need to know all this, but the bottom line is that whole thing about what the venoms can do down the bottom left, all those things are bad, okay? So histamine release, you get swelling, you get degranulation of mast cells, so it's very, very painful, very, very swollen. It can cause some blood clotting, and in rare cases, you can actually have anaphylactic shock from these things. So some of these envenomations require specific antivenoms. We'll talk about that. There's a few things around the world that you can get antivenom for: stonefish, box jellies, and so forth. And if you need antivenom, you need antivenom. But you need to be aware that the antivenoms are usually produced in sheep or horses. So some people can have an allergic reaction to the carrier that they devise it in, as opposed to the venom. So that if there's any question, you should be skin tested against this. That's not to keep you from getting the antivenom. It just means if you react to the skin test, you're going to need to get either some epinephrine. You may need some sort of steroid or Benadryl to kind of help you not have a reaction. You're still going to need to get the antivenom. It's just a matter of whether or not you need to get prophylaxis. And that's what this just says here. So anybody has a known sensitivity to horse or sheep serum, they've had a positive skin test, or they start showing signs of an allergic reaction with a rash or swelling while they're getting the antivenom, get treated immediately. with diphenhydramine, which is Benadryl. They slow the rate then down. You may need to give people epinephrine to keep them from having shock and so forth from that. These are the classic ones you can get antivenom for, which is the box jelly, the beaked sea snake, the tiger snake, and the stonefish. All of these are stuff in the South Pacific that we don't need to deal with very much here on the Caribbean side. But with travel, it's important to be aware of these things. Okay, so those are envenomations. We've talked about bites and we've talked about envenomations. We'll talk now a little bit about stinging. And with the envenomations, like we talked about, the treatment, we'll go to the second. But stinging animals, we're going to go over a variety of things: the invertebrates, the sponges, jellyfish, stony corals, so forth and so on. And then we'll go into some of the vertebrates, the stingrays, scorpionfish, catfish, sea snakes, so forth and so on.
Dr. Doug, before we get too far, I think it was 4 slides now. There's a question on what does he mean by seasonal versus non-seasonable? Maybe.
Okay, different animals will be around at certain times of the year or not. We have certain things that are seasonal that show up at certain times of the year. Other things are there all the time.
Got it.
Okay, sorry about that. Okay, so in sponges, so all of these things that we're talking about now are going to be treated not by hot water, but by mainly by vinegar. So if I'm going to go into the broad points here as we go along. So bites are going to be treated with irrigation and then antibiotics if needed. If you have envenomations, those are usually treated. They're usually things that are heat labile, meaning they'll break down with heat. So you try to put the most amount of hot water your hand or your leg wherever it can tolerate. That'll help break down the venom and make things better for you, and then treat symptomatically as needed. And all these things, the sponges and the other punctures and so forth, are best treated with vinegar. So these are the kind of things you need to keep in your diver's medical kit. Okay, sponges. There's about 5,000 different species of sponges. They have this very collagenous skeleton, and they can break off the little spindles into your skin. And you can get one of 2 different things. You can either get just a dermatitis from that, or you can get this inflammatory response from the spicules themselves. Unfortunately, you can't really tell them apart. So what you're going to want to do with sponges is first trying to get rid of any of the spicules you can. So you take some adhesive tape and lay it across the area and pull the tape off to try and get as many of the spicules out as you can. And then you're going to use vinegar and try and deactivate things with vinegar. And that usually will work fairly well. Some people can get bullae, which are like blisters or infection. And if you do get that from a sponge, it normally is a very long-lasting problem for it to heal. You may have to finish a course of antibiotics, but it may take weeks or even months for the skin to return to normal. Again, another reason not to touch things. The Coelenterates, these are your Portuguese man o' war, jellyfish, and then a lot of the soft corals and so forth. These all have this general same mechanism, which is these little Cnidae, or which are like little nematocysts that fire the toxin into your skin. Knowing that, getting the idea of the sheer numbers, if you encounter a Portuguese man o' war, which I have to admit I had one time happen to me, I used to compete on the windsurfing circuit, the World Windsurfing Circuit back in the early 80s. And I was drifting, trying to water start, and drifted into a Portuguese man o' war. I would strongly advise people not to do that. Like Steve has said, he would recommend people not get stung by lionfish. I would strongly recommend you not get stung by a Portuguese man o' war either. And to give the size of these nematocysts, just running into one, you could literally get millions of stinging cells. Okay, not tens or hundreds or thousands, but millions. That's how many of these things are. This is kind of a little cartoon as to how that works. So they fire in the envenomation, and there's a electron microscopy here on the right showing how nasty those things look, and that's what's causing the pain when you run into these things. The venoms are a bunch of different proteins and carbohydrates, so they're very difficult to fracture. Now, what's interesting here is, while they will, if you have them in a laboratory, and you heat them up, they will break down. But in vivo, in the human body, they don't. So hot water for these do not work. So this is where you have to use something else. And this is why for these stinging organisms, we recommend using vinegar. In certain mini jellyfish, you can have a really bad response. The myocardium, that's the heart muscle. Purkinje fibers are part of the heart's electrical system, as is the AV node. And this can cause electrical instability of the heart and ventricular fibrillation and death. So very, very uncommon. That's mainly with things like the box jelly, but you do need to be aware of that. All of these things are related to the season. They kind of come and go based on when the jellyfish are drifting in and out. Depends on the species, depends on how many nematocysts you got triggered and hurt you. Same kind of idea with the size of the animal, because again, it gives you how much venom was actually inoculated. And then younger people do better than older people, and people with no medical problems do better than people with medical problems. So the health of the victim is also quite important. If you have somebody that collapses, this happens probably a few times a year in Australia from the box jellies, either surfing, diving, swimming, and they have like a near drowning and they just collapse. One of the things you always worry about is they got stung by a box jellyfish. And those people need to be carefully examined for any cutaneous lesions, skin lesions, and considered for if box jellies have been in the area for maybe an antivenom. Again, don't mean to be scaring people with this, but you can have anything from very mild to very severe kind of envenomations. The mild ones, like a minor jellyfish sting, will give just a skin irritation. You get this immediate stinging, or if you have to touch fire coral, you get that immediate stinging. It then moves on to kind of an itching. That's what pruritus is. Paresthesias are some nerve issues and throbbing pain. Things like jellyfish will classically leave kind of tentacle prints across the body where it was contacted. And these little areas, if you get them, can last up to 10 days. This is kind of examples here. Somebody got stung on their backside, and then this woman who got stung on her side. And you see kind of like, especially the picture on the right, you can see exactly where the tentacles were laying up against her skin. And those will probably last for weeks, a week or two, probably. If you get a lot of envenomation, you can actually get local necrosis or death of the skin with an ulcer. If you have breakdown of the skin, you're very high risk of bacterial infection because you've lost your area of defense with the skin, and that requires antibiotics. This takes about a week or two to happen. And some people after that, if they've had a really bad one, their skin will get darker pigmented, and that can actually last a couple of months before it goes away. Not severe, but you just notice it. And then the really bad ones, again, especially with things like the box jellyfish, you can actually have death. So headache, decreased touch, vertigo, ataxia, paralysis, so forth and so on. And you can actually go into anaphylactic shock and die. Very, very uncommon. Don't mean to scare people, but just be aware that is out there. And this is just more of the very severe things that can happen to people. This is an episode. This is an example of somebody who had a box jellyfish, and you see how red and ugly they are and what the legs and so forth look like. And this, unfortunately, was someone who passed away. I don't know this case, but it was given to me of a swimmer in Australia. So treatment. We really only treat the bad ones, which would be the Portuguese man of war, the box jelly, because they can cause rapid decompensation with low blood pressure, wheezing, and even seizures. Anybody who has some of these type components, even if they get better, you need to watch them for a while. We usually recommend at least 6 to 8 hours because they can get better and then get worse all of a sudden, and you wouldn't want them out of the hospital. The only one that has a specific antidote is the box jellyfish. So that's the one to be aware of. And again, that usually happens in Australia. Mainly, the problem with these things is pain. So you give people whatever pain control they need. Some people require opiates. I was telling Steve before we really got started that I was on a dive boat when someone got stung by or got envenomated by a lionfish one time, and they had such severe pain. Their hand blew up to about twice the normal size, and they were writhing in pain. And we got them back to the dock. They went to the hospital, and they actually got admitted to the hospital for IV narcotics for a few days. It was that painful. So some of these things can be very, very bad. You can also develop muscle spasms from it, and that's just ways to treat muscle spasm. The vast majority or so, just a dermatitis or just a rash. It's important if you get a jellyfish sting at the beach, whether you're diving or just playing at the beach or whatever, realize that you want to rinse that off, but you want to rinse it with seawater. Okay, you don't want to rinse it with fresh water because the osmolality of fresh water is different, and it will cause the nematocytes that haven't fired yet to fire. So you'll actually get people worse. So if you're going to rinse people, rinse them off with seawater, not with fresh water. Do not rub it because, again, that can break down the nematocytes that you've been lucky have not fired yet and make them fire. And again, like all of these envenomations, you're going to be using acetic acid or basically vinegar. The best way to get the nematocysts off is by shaving. So if you remember, we mentioned with sponges, you can frequently take tape and put tape over the skin and then pull the tape off. Then it'll get rid of some of the spicules. For jellyfish, you want to take a shaver, like a razor, and scrape along the skin and try to get the tentacles and then mantis off that way. You can then use a top anesthetic if you need to. Again, remember about tetanus prophylaxis and antibiotics. And please, I don't know how long this has been going around the dive industry, but please, for jellyfish stings, do not pee on your dive buddy. There's all those things that have been going on for years. That, oh, if somebody gets a jellyfish sting, just pee on them. That'll make it better. It doesn't make it better. Okay, the idea is that some people's urine is a little acidic, some is more basic. And I guess the idea is like your vinegar is acidic acid, so maybe if you peed on them, it'd make things a little bit better. But just keep a little bit of vinegar in a small bottle and use that, not peeing on your dive buddy. Okay, some people could get a delayed reaction after a jellyfish sting, which can last for a couple of months. And again, like we were saying before, you can get this hyperpigmentation where your skin looks darker colored. Most of the time that goes away. If it doesn't, there's some ways we can treat that with some other chemicals. This is probably some of the more common things that happen to people are these hydrozoas. These are kind of look like little flowers underwater. They'll sting you, kind of bump into these, or you may have them on an anchor line or something, or fire coral like you have down there below. Again, if you touch these things, you'll know it instantly. It's like something just lit you on fire. Just kind of rinse things off. And again, seawater, not fresh water. And you want to have vinegar for these things. So anything that stings, that's kind of the take-home point. Stinging stings, or you use vinegar. Puncture wounds, we use hot water. Stinging things, we use vinegar. This is Portuguese man of war. That's what they look like. Again, very, very pretty animals. Those tentacles can go multiple feet underwater. And again, some people get a skin rash from it, muscle cramps, topical pain, and you're going to use vinegar and so forth for that. These are the box jellies. Again, the ones that can be fatal. It's the most potent venom in existence. These small little box jellies can kill people easily. Mortality is about 15 to 20%, and this is one of the ones we do have an antivenom for. You would still use acetic acid or vinegar, but these people need medical care immediately. And thankfully, the areas that have these kind of know when they're in the area, and doctors and hospitals are prepared for that. There's another one called a sea nettle, which is similar to the box jelly. It's treated the same way. There's no antivenom for it. And it tends to be less lethal, thankfully. This is what we see in Florida all the time. Usually it's right when the water temperature starts to warm up. So we'll get this around May or so every year. So the water that's kind of been in the upper 70s is kind of moving into the low to mid 80s. And all of a sudden you get this outbreak of what they call sea lice. What it really is, it's larvae of the thimble jellyfish, and it'll be on the areas that were exposed. So if you're wearing a wetsuit, full wetsuit, you'll get on your hands, your feet, and your neck. The treatment, again, because it's stinging, is going to be vinegar. Okay. This is what's really important, is this second bullet point, okay, in that it can remain in your bathing suit, okay? So even after it's dry. So if you have this happen, don't hang your bathing suit up to dry and then put it back on tomorrow, okay? You need to wash anything that was in there. So wash your wetsuit, wash the bathing suit, and so forth, to try and keep this happening. Or you could have the same thing happen to you the next day. So it's very, very important to wash it. Usually you may even want to throw in a little bit of vinegar into the wash, but then soap and water to try and kill these things. But it's very, very common in Florida. Like I said, usually in the spring to summer of every year we'll have this. And certain people react to them differently. I've had it happen, and I just usually get a little sting. Our son, who he has some dermatologic condition where he kind of always overreacts to things. When he had it, he just broke out, like a horrible red rash kind of everywhere. So different people respond to it differently. Nothing life-threatening, but just very, very annoying. You can also have the Anthozoas, which are anemones, corals, and soft corals. When you touch them, they can also cause stinging, and again are treated with vinegar. Same kind of thing. Here's nice, beautiful anemones. Please don't touch them. Oftentimes photographers want to kind of wave the tentacles out of the way to try and see what small little crabs or shrimps or so forth are living in the anemones. That's fine, but I wouldn't recommend touching them. Okay, the clownfish and anemone fish and so forth do very, very well inside anemones, but the reason they're doing that is because they tend to sting other animals. So that's how they're able to use them for protection. Most of the time, if you get a sting by a soft coral or an anemone, usually your symptoms will go away by about 2 days, and the vast majority don't require much in the way of care unless you have some sort of secondary infection. And again, the pain, because this is a sting, is best treated with vinegar. This is the most common injury probably that happens is hard corals. And this would be somebody who is like kicking along the reef or reaches out their hand and kind of cuts themselves. Again, you'll get a stinging pain. You can get a cellulitis. If you get a cellulitis, again, this is a marine environment, so you'd have different antibiotics to be aware of. And these can take a very, very long time to heal. They could take weeks, even a month or so to heal from a cut from stony coral. Here's a surfer that got tossed on the reef. So he's surfing, and as you know, waves break because of the shallow water. The shallow water often tends as a reef. So if you get tossed down, you can get all scraped up. Treatment is simply, if anything is open cut, you'd irrigate. You can use peroxide, you can use vinegar, and so forth. And the wounds can be slow to heal. You see this finger on the bottom. That's not a blister. That's just a soft. It's a connective tissue kind of scar and so forth. It's kind of slowly healing in somebody who cut their finger on some coral. Again, all these things frequently happen if you just don't touch things. Here's starfish. Don't play with starfish. Pick things up. Same kind of thing can happen. You can get stung by things. The spines are porous. Usually you'll get pain that lasts a couple of hours. And best treatment, again, if it's puncture, is going to be hot water. And if it's just a stinging kind of sensation, it's going to be vinegar. Sea urchins.
Doug?
Yeah.
There was a question
Sure.
about the vinegar. Is it any type of vinegar, or?
It's usually 5%, but usually kind of any vinegar is fine. Just household vinegar, just whatever you can buy at the supermarket works just fine.
Thank you.
Yeah, I usually keep a small little bottle of it around in my, a little kind of a DIY medical kit kind of thing, just to pour on things if we need it. Sea urchins, those who've been diving a long, long time know sea urchins are a mark of the health of the reef. We used to have tons and tons of sea urchins in South Florida and in the Keys. They then had a die-off, kind of, I think, back in the 80s or so. Steve, correct me if I'm wrong there, but something like that. They're kind of making a comeback. These are, if you've ever stepped on a sea urchin, you will remember it. They tend to break off inside your skin, which I'll show you in the next picture. Some of these, the black sea urchins, can have spines that are up to 1 foot in length. It's immediately painful, and the problem is they break off and they're hard to get out, because when you try to pick them out, they just kind of shatter. So it's really difficult to get them dug out. And if you leave the spines in there, the discomfort and the inflammation is worse and lasts a lot longer. This is an example. This toe on the bottom is somebody who's walking barefoot and stepped on a sea urchin like that. These small sea urchins, you can see the little arrows pointing to the little things that are broken off inside the skin. Those being broken off can be painful and irritating and can cause inflammation and so forth. The easiest way to get those out actually is to dig them out with a pin. So you want to take like a safety pin. I would recommend putting a lighter to it so you make it really hot and kill any bacteria that could be on the safety pin. And then have a good friend of yours just kind of, if you can't reach it yourself, kind of dig these out little by little and try and get as much of the black sea urchin out as you can. That can be difficult, but it's what I recommend. Here's an example somebody got in their hand. That's a ultrasound on the bottom left with this. That's the spine broken off in the hand. And if you look up on the upper right there, between those are fingers. That's the hand and the fingers. If you look between the two most right side ones, you see these little horizontal line. Those are the spicules, or the spines that were broken off in the hand. So difficult to get those out. Again, don't touch things. Sea cucumbers. Here's some. Yeah.
Can I interrupt really quick? Can you
Sure.
I think it's 3 slides to the starfish.
Starfish. Yep.
What kind of starfish is that on the bottom?
That is a crown of thorns.
Perfect.
Okay, that's a bad one. It's a really bad one. If you're going to step on a starfish, pick a different one. We had a poor lady in Fiji that jumped off the boat. We'd just gotten there like the day before. We were at Benga. And she jumped off the boat and stepped right onto a crown of thorns starfish in about 3 feet of water. Her foot got about twice the size of normal. She was in excruciating pain. We're in the middle of nowhere. Luckily, it was a diving medicine trip. So there's a bunch of docs around. So some people had some narcotics and gave her some pills. She kind of laid around the pool for 4 or 5 days before she was able to get back in the water diving. So yeah, that's a bad one. Okay, and that's what we just showed there. So here's someone picking up a sea cucumber. Please don't do that. They look kind of fun, like they're kind of harmless, but there's a couple problems. They can cause a dermatitis, a rash, and so forth. But also, they tend to eat the things that have the nematocysts, so the ones that cause those stinging cells, they tend to eat those. So you can get stung with the same kind of nematocysts from the sea cucumber that you would from the actual Cnideria and so forth. So again, treatment's the same, acetic acid, vinegar, just to try and relieve things there. This is a cone shell. I'm not going to get into a whole lot of the cone shell. They're very, very dangerous. The bottom line is you get a nice, pretty shell. If it's on the ocean floor, just leave it alone. These are really, really nasty toxins. They inject a rapid-acting venom. It's like they've got like this dart that just kind of stabs you with, and it can cause basically anything from pain to paralysis to syncope, which is passing out, to death. This is kind of what the thing looks like down there on the bottom. That's that venomous tooth, and it just is like a dart. So if you happen to pick this thing up, it's a defensive response. It will stab you to try and get you to leave it alone. And again, it can be a very, very bad thing to get stung with. What you can do with that, since it's a puncture, is going to be hot water, and then whatever support you need from a cardiovascular standpoint. Like I said, people can actually have cardiovascular collapse and can die from this. Octopus look cool and they're fun to play with. If you like to tease them with their tentacles and so forth. However, they can bite you, and the bites from an octopus can be quite bad. In general, they tend to just cause some mild redness and swelling, but you can get very bad responses with numbness, paralysis, blurred vision, so forth and so on. Treatment for this is just a matter of how bad it is. If it's a minor bite, you treat like all the other minor bites. If they start having systemic symptoms, you need to get to a hospital for support. Stingrays, we always have to put this in because of the Steve Irwin kind of problem. So we'll talk about stingrays, scorpionfish, and the lionfish and so forth. I'm not going to actually bring up catfish and weaverfish. Most of us aren't diving with catfish. And we'll talk a little bit about sea snakes. So stingrays, this happens probably the most common kind of injury here because in Florida we have what's called the stingray shuffle. Do you guys know what that is? That's if you're ever walking at the beach, you don't step. You don't lift your feet up and step as you're walking along shallow water. You always shuffle your feet, because if you shuffle your feet, the stingrays will move out of the way. The time you get into troubles, if you step directly on the back on the top of stingray, the defensive mechanism is going to be to fire that barb into your leg. Okay, so you do what's called the stingray shuffle. So just shuffle your feet. So if you ever come to Florida, you're walking inside, shallow water, just shuffle your feet, and that will usually keep you from having any problems at all. These can be very small, up to 12 feet in size. They're non-aggressive. They're bottom feeders, and they're entirely defensive with their response. This is what one looks like. It's not a very good quality picture, but you can see this like foot-long barb there on the bottom left. There's someone who's got stabbed in the bottom right in their hand. And the vast majority of these things are just painful. But again, some people can have a very overactive response and can develop hypotension and shock from this. Very, very uncommon. The Steve Irwin problem was he was swimming over the top of a very large stingray. It then, as a defensive move, it was not being aggressive. Defensive move stabbed him in the chest. That punctured his heart, and he developed cardiac tamponade. He bled out of his heart and died. So again, these are purely defensive. It's both a traumatic puncture wound and an envenomation. There's venom in there as well. It's very, very common to get a secondary bacterial infection. So these people definitely need antibiotics and to be watched carefully. Hot water immersion, pain control, so forth and so on. We've already talked a little bit about stonefish, scorpionfish, and the lionfish down there. It can be incredibly painful. It's similar in potency to cobra venom. It can cause, this is the stonefish, it can cause direct muscle toxicity and can cause hemodynamic collapse. And this is pretty much the same thing. So as far as how bad these are, lionfish, and I think Steve would disagree with this term, but lionfish are considered mild on the spectrum. I don't think anything about his encounter was mild, but that's on the spectrum here. Scorpionfish tend to be more moderate, and stonefish can actually be a life-threatening problem. So again, stay away from these things. The pain is immediate and intense. It'll peak at about 90 minutes and can persist for hours and can cause lots and lots of side effects and just very, very severe pain. Again, immerse in hot water because it's a puncture, local anesthesia. Try to remove whatever spines if there are some in there. And that's misspelled. There is a stonefish antivenom that's manufactured that can be given. So like there is a venom for box jellies, there's a venom for antivenom for stonefish, because these are very, very severe. These are only in the Indo-Pacific. These are not the scorpionfish you see in the Atlantic or the Caribbean. Those are scorpionfish that are a little bit worse than lionfish, but not as bad as the stonefish in terms of pain. I think it'd be next to impossible to get stung by a surgeonfish because they're so they get out of your way. But do realize that they're called surgeonfish because they have these jackknife appendages on their tail. That's why they're called surgeonfish. So these little sharp barbs. They can be used as a defensive mechanism against fish trying to eat them. It's a laceration. There's no venom. So just irrigate with hot water if this were to happen. I've never heard of anyone getting stung or cut by a surgeonfish. And that's where the little spines are right there. Sea snakes. This is something else people tend to worry about, but it's very, very difficult to have a problem with the sea snake because their mouths are incredibly small. They could probably get you if they bit you between the soft tissue between fingers, but that's about it. This is their area of distribution here on the bottom right. They're in the tropical and warm waters of the Pacific and Indian Oceans. They do not have sea snakes in the Atlantic or the Caribbean. If somebody comes up from a dive in the Caribbean and says they saw a sea snake, what they probably saw was a sharp-tailed eel. But anyway, we do not have any sea snakes in our area over here. They're usually docile, they'll flee. There's lots of places, I'm sure you've seen pictures in the Pacific where people have just tons of sea snakes kind of swimming all through their gear. It kind of freaks people out, but it's very, very unlikely they're going to bite you. They do have hollow maxillary fangs. 80% of the bites don't result in envenomation. They'll bite but not inject venom. They're just trying to get people to leave them alone. If they do inject venom, that's a problem because this is a very, very toxic neurotoxin, causes respiratory paralysis and death. Again, it happens most commonly in remote fishing villages and boats where they kind of get bycatch and the people are trying to get them out of the boat or out of the nets and they get bitten. And there is an antivenom for this. So diagnosis is based on kind of where you are in the world. There's not usually pain initially. There will be fang marks like a snake. Maybe somebody actually saw it happen. Onset happens within 2 to 3 hours, oftentimes just within a few minutes. If people start to lose their vision, that's a pre-terminal. Those people are dying. That's one of the last things that happen is there's people begin to lose their vision. And the initial treatment is similar to terrestrial snakes where you're going to treat the puncture wounds and get an antivenom. Okay, we're going to be wrapping up. You don't need to know all of this. I'll make it even easier here at the end as far as how to remember things. But this is kind of how the things go. If you have a puncture wound, okay, that can be something like sea snakes, blue-ring octopus, cone shells, and so forth. Your treatment is going to be to get the venom out if you can, respiratory support, because all those things are bad. The more minor, and I use that term loosely, puncture wounds like stingray, lionfish, scorpionfish, and so forth, use hot water. If it's a stonefish, you get antivenom, and then you're going to consider antibiotics because of the puncture for superimposed bacterial infection. If things have a rash or they sting, things like fire coral and so forth, you'll see is vinegar, 5% acetic acid. For box jelly, you'd want to get antivenom. If it is jellyfish, you could shave that with a razor, try and get the rest of the tentacles off. If it's sponges, you extract the spicules with adhesive tape. If it's bristle worms, you can do the same thing. It's fireworms. And seaweed or the other soft things, you're just basically going to use vinegar. So this is kind of classically when you use the various things. You're going to use vinegar for sponges, for box jellies, hydroids, fire coral, worms, hot water for puncture wounds of things like starfish, sea urchins, stingrays, so forth and so on. And to put that in a little bit easier kind of context, first off, here's what you need in your first aid kit. This is what I recommend everybody kind of have available on a boat and so forth, which would be vinegar. I think you see how we use that a lot. Rubbing alcohol just for cleansing things, fresh water if you can get it, some sort of antibiotic ointment just to put on things to avoid any kind of secondary infection, any kind of pain medicines you can have, tape for the sponges, tweezers if you can use it to get some of the spines out from a sea urchin, a shaving kit for tentacles, and then whatever kind of wraps and so forth in case someone's bleeding. So, conclusions. Number one, the best way to not have a marine life injury is to avoid it in the first place. And the best way to avoid marine life injuries is practice good buoyancy. We talked about that initially. So work on your buoyancy, take a buoyancy class if you need it, but work on your buoyancy. Don't touch things. If you touch things, that's how you get stung and envenomated and so forth. Don't harass marine life because most injuries are defensive. These are not animals that are looking to hurt you or looking to eat you. So if you don't harass them, they won't harass you. And the exposure protection for any kind of incidental bumping up against something, getting a cut or a sting or burn. So these four things of practicing good buoyancy, not touching things, not harassing marine life, and wearing good exposure protection will avoid almost every marine life injury. However, if you tried all those things and you're still very unfortunate, what do you want to do? Okay, here are my little take-home points. Okay, you want to tape a sponge, tweeze an urchin, and shave a jellyfish. Okay, and the way I remember that is like we talked about with a sponge, you've got these spicules that you want to take Scotch tape or some sort of tape and try and pull the spicules out. With an urchin, you want to try to take some tweezers and try to get out as many of those broken off spines as you can. And for the jellyfish, you use a razor to try and get off the tentacles. So try to remember, tape a sponge, tweeze an urchin, and shave a jellyfish. The additional treatment, if it's a bite, flush with saline or with water. If it's a puncture, then you're going to want to use hot water as hot as you can tolerate to try and deactivate the venom, because most of these things will break down with hot water. And if it stings, something you touch that it was stinging, use vinegar to neutralize that. And then obviously get a hold of medical advice regarding whether you need to be taking antibiotics afterwards, whether you need steroids, if you need a tetanus shot, and so forth. But if you remember to tape a sponge, tweeze an urchin, shave a jellyfish, and remember that for bites, you use water, for punctures, you use hot water, and for stings, you use vinegar. That will get you through almost every marine life injury that you could possibly get into. And I think that's everything. It's been just about an hour.
Hey, Doug, one question that just came in was, Michaela was asking what the difference is between a sea snake and a sea crate.
Oh, they're similar. Yeah, it's the same family. It's actually certain forms of sea snakes that have that's usually the banded sea snakes are the ones that are the ones that are the most venomous and the most dangerous to take. That's what we have venom to. But there are a variety of sea snakes and sea crates. They're kind of variations on a theme. Treatment will be the same.
I had a comment. By the way, guys, feel free to throw your questions at the chat.
I've got a lot coming. It's awesome.
Uh-oh.
Okay.
Good questions. They're all really good questions.
Why don't you go, Kelly?
Okay. Paula would like you to pretty please put the medical kit slide up again. She didn't writing it.
There you go.
There was another one I just missed. Excuse me. Can we get that flow chart, that really handy flow chart? I think we have a copy of something similar, but I did like that. Yep.
Sure. I'll actually, after this talk, Kelly, I'll send you the, I'll just email you the entire slide set. And
Awesome.
That way you can get it to the customers. Anybody that wants the whole slide set or wants the individual slides, you can get it to them.
You're the best. Thank you. Let's see, for everybody who's asking, yes, we are recording. I'll make sure we get it up on YouTube and we'll put it up on our page as well. And then should we also have things like gauze and medical tape in our medical kit? So I'm going to say probably yes.
Yep.
Yep.
In case there's a bite or something like that you want to wrap.
Right. Is there a course with Dan or another agency? I'm not sure about SSI.
I think Dan has some sort, I don't know exactly what the course is. They do have something on hazardous marine life. There's something,
Awesome.
Don't quote me exactly how that works, but you can probably find it on their website. They probably have one of their online things on that.
Perfect.
Hopefully they say a lot of the same things.
I would hope so. All right, Steve, go ahead if you have some.
Yeah, I was just going to make a comment about the man of war, and you can verify this, Doug. But when I saw one in Hawaii one time from a boat on the surface of the water, and I was surprised at how tiny they are.
Yeah, they can look really small on the surface. They may be the size of a oversized grapefruit or something on the surface.
The tentacles extend
20 feet.
a long way.
Yeah.
But yeah, you'd think with the name Man of War that they would be, these huge, gigantic things. But my understanding is they're relatively small.
Right. Their surface area on the surface is quite small. That's why you can kind of not see them, in fact, and not see they're coming. And the problem is their tentacles are really long and really deep. So what you actually get hit by is the tentacles underneath the water. So they looks pretty unimpressive from the surface, but down below they can be very, very impressive. And the number of stinging cells they have is huge.
Also, one of the problems with those is they wash up on the beach sometimes.
Right.
And
people touch them.
Or you can step on them on the beach and have the same problem as if you got stung underwater.
Absolutely. And they also tend to be very pretty. They tend to be kind of purple and so forth. So they kind of catches people's eye on the beach to walk over to them. And like you said, if you happen to step on the tentacles, you can have a problem.
I'm a little disappointed about the peeing thing though, Doug.
You've always wanted to do that, huh?
I'm not disappointed by that at all. Question on antivenom. What I'm assuming you usually get those at like a hospital, but what if?
Yeah, that's the only place to get it.
Perfect. Even if you're on a liveaboard, you got to make it back to a hospital.
Yep. Yeah, they're not going to have that. They're not going to have that on board. That's going to be just like getting snake venom. You know, you have to call a poison control center and see the closest place that has antivenom.
Cool. For a DIY kit, is 3 ounces of vinegar enough? That's really all we can take.
Yeah, that's probably okay. I mean, it's probably okay. Yeah, that's all you can take on a plane anyway.
You can generally buy vinegar at most.
Most places you can probably buy vinegar if you get to a grocery store. You know, kind of thing. You probably have a little bit more of it around.
A lot of dive outfits have vinegar as well. So cool. Any other questions?
The other thing, by the way, some of these heat packs is not a bad thing to have either, because like we said, you want to have, like, you get stung by a lionfish, let's say, and you're on a boat, you're going to want hot water. Well, you're not going to have hot water probably on the boat, but if you take a heat pack and pop it in some water, and so it heats up quickly, then that could be something you could use to see how hot, just how hot you can tolerate something. So some way the little chemical heat packs is never a bad idea, especially if you're not going to be close to shore.
Cool.
Someone's got her hand up.
Kelly, I shot you a question. I was just confused a little bit about when flushing with seawater versus freshwater is appropriate.
Okay, mainly almost everything you're going to want to, if it's something is a puncture wound, so you've got a bite or a puncture, then you're going to want to use either saline if you have it, which is 9.9% saline, or just tap water, just water to flush, because what you're trying to accomplish at that point is you're just trying to flush things. The one time you'd want to use seawater as opposed to regular water is not because you're trying to flush out a wound, it's you're trying to get those tentacles off. So you're trying to get rid of tentacles. And if you use fresh water on the tentacles, you'll fire some more of those nematocysts to make the pain worse. So the one time you can do that, same thing would happen if you took the example Steve said, you're walking on the beach and someone stepped on a jellyfish on the beach. Now their foot's killing them. The quickest thing to do, if you have a glove, obviously put a glove on. To put a glove, get some wet sand, okay, salt watery sand, and scrape and kind of wipe things off with sand, and then kind of have them rinse it off in the salt water. That way you can get rid of as much of the tentacles as you can. The sand will kind of help get rid of some more, since you don't really have a razor to shave them off, and then get them in the salt water to kind of rinse things off. Whereas if you said, "Oh, I've got some water in the car, I'll pour some water on you," could actually make them feel worse. It's not going to be a life-threatening problem, but it will make their pain worse. Does that make sense? Did I explain it okay? Okay, thanks.
There was another question I definitely don't know the answer to. Somebody was in Antigua in November, lots of jellyfish. When they got back to the boat, they said it wasn't stinging season.
Okay.
Is that a thing?
Potentially, depends on the jellyfish. The moon jellies don't tend to bother you very much. So, I mean, I've popped up through hundreds and hundreds of moon jellies when they kind of come rushing through, but they don't sting. So it kind of depends on what the jellyfish are and so forth. So the jellyfish stinging is definitely seasonal. Like we're talking about seasonal, non-seasonal. That's definitely something that's seasonal. So they kind of drift in with the the tides and so forth. And it depends which ones are around and water temperature and types and all that kind of stuff.
Have you ever done Jellyfish Lake, Doug?
Yeah, that's kind of cool. Because they've
They've
kind of lost their ability to. They still apparently they do quote sting, but it's just such a minor thing that humans don't feel it. But
I was just going to say they have, because it's a confined area that the jellyfish have been basically trapped in. They've lost their ability to sting because they don't have any predators. Right.
There's nothing to kill them, so they don't need them. They don't need the predators. Yeah. Or don't need the stinging cells.
So you can swim through like a massive bunch of them and have them brush up against you, and you won't even feel it at all. So
that's so cool.
Yeah, along those evolutionary things, it's kind of cool. If you think about turtles or tortoises, there's 2 types of turtles that can't pull their head inside their shell. Okay, there are the Galapagos turtles, and they have a saddle-shaped shell, so they can get their heads up higher to eat foliage, and that's because they have no predators in the Galapagos. And the second are sea turtles. That's why they have to sleep with their head under rocks, because they can't withdraw their head into their shell. And the reason for that is because tiger sharks eat them whole. So the ability to pull their head into their shell would not be particularly advantageous anyway. So interesting little fun fact.
Any other questions, Kelly?
Fascinating. One more. Taylor said when she was a kid, her parents, would put meat tenderizer.
Yep, same sort of thing. That's actually not a bad idea too. You can do that as well. Vinegar is probably better, but meat tenderizer for like meat tenderizer, what it basically does is it breaks down the meat. It breaks down it's like an enzyme that breaks down the meat. So if you took like I'm blanking on the brand, but if you take a meat tenderizer and sprinkle it on jellyfish, the jellyfish tentacles, that can also help break down the tentacles as well. It's better if you could just scrape them off. But Adolph's, I remember that's Adolph's meat tenderizer. You can actually sprinkle that on as well. That's not a bad second plan if you have that around.
Awesome. And Michaela also asked, can you go diving after getting stung by a coral since the healing can take months?
Yes, you can. If you have an open wound, I would be careful. If you've just got a rash or some sort of thing like that, where there's no actual break in the skin, I wouldn't be as concerned. If there's an opening in the skin, you'd have to be a little bit more cautious, and you probably want to at least either avoid diving, avoid immersion for a long time, or be very, very cautious watching that and keeping topical antibiotics and broad spectrum antibiotic ointments and stuff on it, and just being very, very careful while it's healing.
Awesome. Any other questions? These are great questions, guys. Everybody's saying thank you. Just a quick mention, if anybody is suddenly feeling like they need to work on their buoyancy a little bit, that is something that we can do in confined water. We offer it as a specialty. It's one dive in confined water, something we can do right now. So if you feel like you need a little bit of practice after this, if you want to be a little extra cautious, a little safer, give us a call.
Never a bad idea. That's
Definitely.
That's probably one of the top courses everybody should, in my opinion, everyone should take rescue, and everybody should take a buoyancy course, just because we don't do a great job of teaching buoyancy in open water, or in advanced open water for that matter. In general, you guys may do a great job, but in general, buoyancy is one of the things that people are not real great at. I have all my, when I have people show up for advanced nitrox or trimix training and so forth, and the first couple of days we're spending just getting their trim and buoyancy down, and these are people who've been diving for a long, long time. So, and cave the same way, getting cave students trimmed and buoyant is quite important.
Again, I want to thank you so much, Doug, for your generosity and knowledge, willingness to share your knowledge with us. And if it's okay, we might hit you up for another one of these coming up.
Sure, no problem.
Doug's got a lot of topics that he's offered to share with us. So big thank you to you for your time and your generosity. And I want to just remind people that we're trying to do these things on a more regular basis. And we're very excited because we've actually lined up for August 7th or 8th. We're still working on the exact dates. We're going to be showing a film called Watson, which is the story of Paul Watson, the founder of Sea Shepherd. And Paul has agreed to actually do a Q&A with us for that showing. So that's pretty darned exciting. And we'll keep you posted via our email and our Facebook and our social media. We've also got a confirmation from Peter Hammerstadt. If any of you know who he is, he's kind of Paul's right-hand guy at Sea Shepherd. He's the captain of the Bob Barker. He did a talk here, I don't know, 6-7 years ago. It was very well received. He was kind of the star of the TV show Whale Wars, which was, I think it was Animal Planet that had that series on a few years ago. Peter's a great guy, and he's also offered to come to do a virtual talk for our clients on August 28th. So be on the lookout for that. We've got a bunch of other exciting things coming up too, so we'll keep you posted. But thank you all so much for participating. And again, Doug, can't thank you enough for your time and your effort. And
you're welcome. I'm actually getting ready to hit the road. It's about 20 till 9 here. My wife and I are driving down to West Palm Beach. It's about 2.5 hours. I've got 5 open water students tomorrow morning for checkout. So we're going to do some checkout dives tomorrow. So it should be
awesome.
Fun.
Good for you. Congratulations. Yeah. I'm so anxious to get back in the water. I can hardly taste it.
Yeah, we've actually, that's one thing that's been very, very fortunate for us here in Florida is the boats are back open. I counted up the other day, and we also, I cave dive, so that's pretty well easily available. So I counted up last week, and since I recovered from COVID, which was in April, I did my first dive in May after recovering. So since May until now, I've already gotten 35 dives done. So not doing too bad.
Yeah,
You guys are welcome to come to Florida anytime. We got lots of diving here. Just avoid the COVID-19 where it's a disaster at the moment.
Anyway, thanks guys, and look forward to the next time.
All right. Thank you all very much. I appreciate everyone's attention.
Have a great
Thank you very
evening.
much.
Very welcome.